Okay. So we're gonna do you guys have any questions for me or what any thoughts? What's going on?
Sorry.
No.
I'm good.
I don't have any questions so far. I feel like your explanation prior to this meeting was very thorough and really well thought out, even though I had a hard time kind of grasping what it is I need to be focusing on. But yeah, no questions so far.
Okay. Well, we can work all of that out. How about you, Fran? Do you have any questions?
No, I mean, I understand the goals and goal setting because that's what pretty much I did for my job. I think it's a little harder to do something like that when it's an emotion versus a task. And, and
yeah.
A metric, I guess, a metric.
Yeah, but that's why I try to do a step by step. So that's why I'm glad we're going to go through it today, and that way we can you can see the process at work. So Amanda, let's start with you.
So yeah, go ahead. Sorry, the audio is still kind of catching up, so I'm waiting a second.
You're good. So what would you say your top 3 emotions are when you're talking about about your LS?
I would say frustration.
Okay.
Somewhat anger.
Okay.
And irritation. Just like emotionally irritation, not obviously the physical part, yeah, but emotionally irritating because it's a little hopeless sometimes, and it just causes so much anger and like nothing to lash out at.
Okay. And so, so when you are looking at your frustration, why are you frustrated?
I think because my experience so far is that there's not enough information. I mean, with everything that I do in my life, I like research and like figure stuff out on my own when I don't understand something. And this is one of those things that I've done a lot of research and it still kind of just takes me in circles, and not being able to really like 1, 2, 3, ABC, black and white, like this is why this. And it just really frustrates me that it's like that, and that even the professionals that you would think are helpful, like your doctors, have very minimal things to say about it. I find that like the core of the frustration is that I'm kind of on my own when it comes to dealing with it.
Okay.
And figuring out my own path instead of being able to like follow steps perfectly.
So why do you think lack of information frustrates you? Like go a level deeper. Why is that lack? Why do you feel like not having the information at my fingertips is so frustrating for me?
I think because we are living in the era of information. You know, we can research anything we want within 3 seconds if we wanted to. And, you know, every day it's easier and easier to find out information on anything. And this is kind of one that stumps us still. And it's really frustrating because it's our bodies that we're dealing with and our, you know, mental health. And
so let me ask you a question in a different way. What would having that information, what would that mean for you?
a better grasp at what I'm dealing with and a little bit more reassurance.
Okay.
Yeah.
So from what I'm hearing, it's more of being able to being reassured that you're going to be able to do what you need to do to care for yourself, and security, knowing that I'm doing the right thing. So your frustration comes from more of a lack of security of not knowing that you are doing the right thing. Is that more kind of on an emotional level?
Kind of.
Because not having the information and not being not and the lack of information and the doctors and everything, take it deeper on an emotional level. For you, what is that lack of information, how does that make you feel? Not so much on the physical level, but emotionally. From what I'm hearing, that frustration comes from a lack of security. Does that sound about right?
Right. Yeah, and like lack of control.
Yes.
Like not being in control of my own body.
Okay.
Is what it comes down to. It's like how I perceive it. Is that I'm not in control of something that I should be in control of.
Okay. So if you got more security and more control, then you would feel less frustration, right?
Mm-hmm.
So I think those should be some of your goals, is to feel more secure, feel more control. That's going to take away that frustration. So there's two of your long-term goals is right there. So now let's tackle your anger. Why are you angry?
I mean, it kind of goes back to the first point, is that I don't like not being in control. Yeah, I mean, I feel like it's a lot of the same things, lack of control and kind of having a disconnect when I've always been someone that health and nutrition is a big part of my life and always has been, and like being in tune with my body and like yoga and all of these things, and like really being in control of those things, and this being something that I can't fix like that. I can't like control it like I can control my health in other ways.
Okay.
And that just makes me really angry.
Okay. All right. And the irritation, same thing, or is something else more irritating?
Yeah, I mean, when it comes to like my experience with doctors, I know I haven't had the horrible experiences that I've learned a lot of other women have. Getting diagnosed and all of that. Mine was pretty straightforward, but still vague. And I think that's where a lot of the irritation stems from is, even at like my last gyno appointment, like bringing it up with my doctor and her just being like, oh yeah, so like, are you like, you're good? Like, here's the cream again. And I'm like, yeah, like, cool, yeah, great. And then nothing else really, like, you have nothing else to say. Like, this is kind of a big part of people's lives that have it. Like, so you don't have any more information you want to give me, or any like updates, or just nothing. Like, oh, you're good. Okay, cool. That's irritation stems from that for sure.
Got it. So, if you can get a better plan from your doctor, or more information from your doctor, or just a medical professional, then that would ease that irritation for you, is what I'm hearing, right?
Yeah.
So
yeah,
I think
at least a little bit. I mean,
yeah.
Sorry, it seems that there isn't a lot of new information, so it doesn't, I mean, I don't really know at this point what could change that when there's still not a lot of, like, thorough information, like new information out for us to see.
So maybe a goal for you, for your irritation, is to find acceptance in what we do know, and kind of getting to developing a plan for yourself that you know, okay, this is how I can treat myself, and I'm just going to accept it, because there's nothing. I tell my husband all the time, there's no point in giving energy to something you can't change. We can't go out, research, and find the answers. We can't, at this time, put any pressure on anybody. So we have to accept what's available and do what we can with what we can change. And so part of what you can change is how you treat yourself, what your maintenance schedule is, how, you know, and advocating for yourself at the doctor's office. So what we're going to cover on week 3, I think, will be really helpful for you, and next week too. Week 2 and 3, I think, is going to be really helpful with the information that you need to know, like the most important information on LS, because there is a lot of information. It's just scattered everywhere. So bringing all the information, the information, so that you can create a plan, an individualized plan for yourself that you can control and you have security in, because you're making this for yourself, fully informed. And then in week 3, creating that plan for how you're going to advocate for yourself before you get to the doctor. So you have a plan when you step into that room, saying, okay, this is what I'm coming out of this room with, or I'm getting a new doctor and I'm starting all over. Then again, that's going to give you that sense of control and security that you need to get over the anger and the frustration. Does that make sense?
Yeah.
Okay. So yeah, I think the goals you want to work towards, again, security and control, and having those plans are 2 of the goals that that'll get you some of the way there. So then what you need to do is think about what else can you do to bring yourself security and control to ease some of that frustration and that anger. All right. So let's talk about motivation. How has your relationships, your personal relationships changed from when you got LS, and where do you want it to be? Like, if it was that your LS was under control and everything was good, this is what my relationship would be like.
That is kind of a like blurry situation for me, because like my relationship with my partner had just started when I was diagnosed.
Okay.
Like within that first year, like 8 years ago. And I mentioned this last time we spoke, but I went symptom-free for a long time. Like there was at least a year or 2 where I didn't even think about it, and basically like kind of forgot about it. Like my medicine expired, like I hadn't had to deal with it in a while, and then it was like wham. And so I've had a partner there going through it with me, and is very understanding and has been really supportive. So there's nothing I feel like that really, I mean, obviously motivation is symptom-free, makes a better physical relationship. And I've managed to maintain a good system right now. So it's kind of hard to address that question right now because I feel like I'm in an okay spot at the moment.
And how about personally, like, have you seen any changes in yourself, like attitude-wise, emotionally, like the person that you are now, is it different than the person you want to become? Like, how does that frustration, anger, and irritation, does it manifest itself in your life in some way?
It had until recently. I feel like I was kind of letting it fester a little bit. Not so much really affecting my relationship, but I was thinking about it a lot. And it was actually a question that or a topic I talked about with my fiance just a couple months ago, because she was like, how often do you actually think about it? Like this disease that you have, how often do you think about it? And I was like, oh, all the time. And she's like, well, how often? Like, how often during a day? And I was like, 100 times a day at least. You know, it's something that I think about. It's my body. Of course I think about it all the time. I think about it when I eat because I've tried to change my diet for it. I think about it constantly. And that was kind of a wake-up call for her. She was like, oh, wow. Like, I didn't realize it was something that was so heavy on your mind all the time. Mm-hmm. I was like, well, yeah, like, if you had issues with your body down there, I think it would be on your mind a lot, too. Right. Maybe I'm not expressing it because I have it managed, but it is something that's constantly in the back of my head that pops up every 10 minutes or something, like, oh, yeah, like, it's still there. But I think since having that conversation, it made it more aware for me, and so I've been trying to kind of let that go a little bit and realize that I can't fester on all of this frustration because it's not doing anything. It's not changing anything by having that frustration and irritation. So, yeah, it's still there, but it's not something I'm letting just, like, boil inside of me constantly.
Right.
Yeah.
That's good. That's a step towards resilience, that, okay, I've got this, but I'm not going to let it take over my life. I'm going to deal with it, and then I'm going to continue living the way I want to live. And I'm not going to let it just, you know, grow. Okay, perfect.
Yeah.
So what would you say, then, is your biggest motivator to get over the frustration, anger, and the irritation?
Just an overall sense of well-being and honestly living carefree again, because I feel like it kind of takes that aspect out of life a little bit because it is something that's always there and lingering. To be able to not have to worry about that is a big motivation. Like, if I can just reach a point mentally where that's not, I mean, obviously physically too, but mentally where it's not the deciding factor in a lot of aspects, or something that's constantly there. Yeah, I think that's it. Just a sense of, like, I've got this, and it's not as bad as it could be. Mm-hmm. Just kind of a little bit of relief, I think.
Okay. So with LS, there is, I mean, we all know there's no cure. So there's always that chance that even if we do go symptom-free for a while, we're going to end up with a flare at some point. But I think with having a plan for, okay, knowing that this is my new normal, at some point I will have a flare, but having a plan to say, this is how I'm going to deal with that flare. I know what to do when I do flare to deal with it so I can get back to living. I think what, is more realistic than saying, okay, I can now be carefree. Because you will never truly be carefree again, because we always have to know that at some point it's coming. But we don't have to live in the fear that at some point it's coming. We can live with the knowledge that, yeah, we've got this, and eventually it will flare, but I can deal with it and then keep going. I may be down for a day or two, but I know I'll be up again, and then I'll be good. Does that sound more realistic?
Yeah.
Yeah.
Yeah. Definitely.
All right. So, what for the rest of your homework, I like your main goals are security and control. And one of the goals we're going to work on, well, two of the goals we're going to work on, is to make a plan for self-care, for your own self-care, and have and make a plan for how to advocate for yourself. And like I said, we're going to deal with those next week and the week after. But come up with another 2 ways that you can get some control or some security with your LS. Try to brainstorm and say, what does that look like for you? And it could be, you know, a simple change. It could be just setting up a reminder for yourself to take your medicine every day at a certain time. Because I know we were talking about before, you're like me, and sometimes we forget. So being on a specified regimen and not missing that will give you some control that you're saying, okay, I am treating myself properly. So maybe a goal is for 30 days, I'm going to take my medicine twice a week at this time on this day, and, you know, specific, you know, do the rules, like we said, be specific, measurable, attainable, relatable, and time bound. And then use the tips and come up with really good goals that you're going to be able to follow for the next however many days you choose to follow, and that are trackable. And I think that's going to really help you mentally as well as physically, because you're like, I'm making steps and progress towards getting that security and that control. Does that make sense?
Yeah.
All right.
Yeah. I already have ideas.
Perfect. So yeah, post them for us. I'm gonna tomorrow it'll have to be just to kind of put a post to see where everybody's at, so we can kind of tweak our goals and stuff. So think about that. I'll post that tomorrow, and we'll keep working on it. And then on Friday we can post our full goal, our fully fleshed out goals. And then at the end of the program, you can go back and see, did you complete your goals? Are you on track to complete your goals if it goes further? And, you know, we can, and if with everybody having their goals there, we can keep everybody accountable, you know? You can check in. You've been following your goals. So that's good. All right. Awesome. Any questions? No?
No.
Awesome.
I like it.
Perfect. Fran, you're up. Your turn, Fran. All right. Fran. All right, so Fran, on your 3 strongest emotions, you wrote disappointment, uncertainty, and frustrated. Is that right?
Yes, that's correct.
Perfect. Let's see. Oh, there we go. All right. So you say your uncertainty comes from how LS is going to progress with you, and having the right treatment course from a doctor, having a doctor that's making sure that you're doing the right things and on the right plan. So what is it that what's going on right now? What's your doctor doing for you that you feel like he's not giving you the attention that you want or you need?
Okay, well, my gynecologist, or my NP, she left in May, and right before I was supposed to see her. And my understanding was she was leaving the end of May. My appointment was May 14th. I get a call like May 10th and saying, we need to reschedule you. And I'm like, well, wait a minute. I'm hoping to get in to see Marie before she leaves. And she said, oh, she left.
Oh.
Well, your letter said it's the end of May. And then we'll hook you up with this new doctor. And I don't know her, but I did talk to her on a teleconference. And she seemed to know something. And, you know, it's the same thing like Amanda said. Well, how you doing? And, well, at that time I was doing pretty good. I said, okay, that's good. And, you know, so I think I don't really need to see you till October. I'm like, well, wait. I said, that's a little far since I haven't seen Marie since last October. And she said, well, I think you're doing good, so we don't need to see you. And in the meantime, I went to have my yearly MLT treatment. And typically my MLT treatments, I'm like looking forward to them because it's like a reset. And so I had the MLT, and next thing I know, it kind of put me in a little bit of a flare, which is the first time I've really had. I'm not itching. I typically don't itch. I always just burn, and this is the first time I had itching, which kind of freaked me out. And when he was very good, he gave me a lower dose of steroid. Gave me these little pills to take at night, told me to take the Landocaine first, put the Landocaine on first, then do the Benadryl cream, and then every day, twice a day, use the steroid. So he gave me a good protocol to follow, and it worked. I was feeling great within like 3 or 4 days after he administered it. So I'm like dealing with 2 different doctors here. Which is kind of putting me in an uncertain state, and I'm going to see that for my follow-up with the MLT next Wednesday.
Okay.
Up in Nashville. So that's a little. I'm like Amanda. I would like to really understand. There's so much out there. That's the other frustration. That's where my frustration comes in. Mm-hmm. You're on the LS support group. And it's just overwhelming. And they have like 100 files. And I keep on saying to myself, maybe I should be sitting down, like devoting a day and reading through every one of these files. And maybe I might be able to then come up with a big, grandiose plan. And then you hear people saying, well, all I did was cut out sugar. And I'm like symptom free. I mean,
I've had that discussion too many times. I don't believe it. Yeah,
well, it's like, all I do is cut out gluten, and I'm just, it's so much. That's like, what? What's wrong with me?
Yeah, no. Nothing's wrong with you. Trust me. They are the abnormality, or they're lying. I'm not calling nobody a liar. I'm just saying. It's not just that.
Or it's like with me where something did work for like a couple months, but then not. So they got ahead of themselves.
Right.
Yeah, maybe.
Exactly. So, okay, so we touched on the frustration that there's just too much information and you don't know what to follow. You don't know how, you can't develop a plan for yourself because it's just too much.
Yeah.
So I think next week will really help you with us talking about the main things, the most important things that you need to know with LS, because there is, like I told Amanda, there is so much information out there, but there are core things that all of us need to know, all of us need to do, and that's what we're going to talk about next week, so that we can each make a plan on an even keel. Like, you can always do extra if you choose, but these are the most important things that are going to keep you healthy and get you on the right path. So I think that'll help you out. And as far as disappointment, why are you feeling disappointed?
Well, I guess I'm disappointed in my doctors in the past. that, I have Hashimoto's, and from what I've seen for the last 4 years, a lot of people that have Hashimoto's end up with LS. And when I was diagnosed with Hashimoto's, it was like no big deal. I didn't even get any thyroid medicine from the ENT. He's like, well, maybe come back in 6 months and we'll see how you're feeling then. But unfortunately my husband's insurance was changed, so I couldn't go back to see him. And then I went to see my person PCP, and I told her that she told me I had Hashimoto's, and she's like, well, we'll just see how it goes. And then 4 months later, all of a sudden my hair's thinning, I'm freezing, I'm having all these bad symptoms. I couldn't see my PCP, so I went and saw the NP, and she's like, well, you need to go see a dermatologist for your hair. And well, okay, well, how about the point that I have the Hashimoto's? Oh, no, it's not that. It's your areata or whatever. So if I'm off to another doctor getting some other little pill, and then I go see my PCP finally in January, because that's my annual. She does my thyroid test and goes, your thyroid's crashed. And at that time, and I started taking the thyroid, and what happens 3 months later? I have LS. I'm a little disappointed in that whole process.
Yeah.
And because I can't disappointment of not being more proactive on the thyroid issue.
Right.
You never know. It might have not made a difference, but it's just back there in my mind.
Just thinking about it. So kind of like what I told Amanda, understandably, that's frustrating, disappointing that they didn't. You felt their management of your care was below par, and you don't feel confident in what they did. But we can't go back and change it. So you living with this disappointment, all it's doing is bringing you stress, bringing your spirit down, bringing negative thoughts, and it's doing you no good. So we can't change it, so we have to accept it and move on. So for that, what we can do is look to the future and say, okay, what can we do so this doesn't happen again? And I think week 3 is really going to help with advocating for yourself, developing a plan for how you're going to make sure that you get the care that you want from your doctors. Developing a plan before you even step in the room, that this is what, I'm not leaving the doctor's office until I have A, B, C, and D, and I feel comfortable and secure in the fact that I'm getting the care that I deserve. Whether it be referrals, tests, whatever it is, you got to be able to say, okay, I'm fully satisfied that you're doing your job, so that I am treated correctly. Mm-hmm. So yeah, let's leave that disappointment in the past. Look towards the future, that it's going to be better, and you're going to get the care that you deserve because you're going to advocate for yourself. All right? I'm not going to back down until they give you the care that you deserve, because the doctors work for us. We got to make sure that they are doing their jobs. And I think a lot of the time, because they're trying to rush us through, and we get so intimidated because they're supposed to know everything and we trust them, that we just let them get away with stuff. But we got to cut that out. And especially as women, especially dealing with male doctors, it can be a little intimidating because you're in a vulnerable position, especially with gynecologists, anybody looking between your legs. It's, you're in a very, what's the word? Not fragile, but vulnerable, yes. You're in a vulnerable position. And so by being by having the plan beforehand and going in there with knowledge, it gives us the upper hand and not having to try to think on our feet. That make sense?
Yes, it's true.
Okay, perfect. So we'll do. So we're going to work on a plan for you, and everybody's going to work on their own individual plan, so that you work on what you need, and to deal with your illnesses and whatever it is that you need to feel secure. All right. That's the way I devise this program. It's very individualized. So there's no one size fits all. It's all about you doing the work and coming up with your own individual program for you that works for you. Because what works for Amanda may not work for Fran. What works for Fran may not work for me. So everybody's got to make their own individual work, and you got to do the work or else it's not going to work. All right? So, motivations. Fran, how have your relationships changed since you got your LS to where is it, how is it different from where you want it to be in the future?
Okay, well, I've been married 40 years, and so I have a very strong relationship with my husband. We have a very good marriage. Of course, with this LS, he's very concerned, and we definitely don't have sex as much as we would want to have sex. And so there it is.
Full confession, I haven't had sex in 7 months. And I actually just had a conversation with my husband earlier, and, we were talking about, I was telling him about more about LS, and he's like, I didn't realize it was so deep. And now, he's like, he got it. He knew that I was going through something, but he didn't realize how bad this disease can get. And just talking to him, because my symptoms aren't horrible. I consider myself very lucky. All I really have is kind of just some itching, and every once in a while I get burning or a fissure, but it's mostly just itching. And with my clobetasol, I'm good. But I know that at any day it could change, but I don't dwell on it. I just know, okay, if it does change, then I'll deal with it. But for me, and what I'm working through on this program is, like I said in the video, is my low self-esteem. It kind of robbed me of my libido and kind of my sexiness, because you don't want to have sex if you don't feel sexy, and so that's what I'm working on for me and my relationship. I've been married, I've been with my husband 20 years, and we have a great relationship, and we talk and everything, but I definitely feel you on the sex, so do not feel embarrassed. It actually, they've done studies that women with LS have less infrequent sex and less pleasurable sex. So we are not the minority. We are the majority. But we can change that. We can figure, I didn't put it into this program, but after this program is done, I am going to be starting a group dedicated to sex and dedicated to figuring out ways that we can improve our sex lives and get back to, being healthy sexual beings, which we are. But, yeah, so definitely sex. All right. And how have you noticed that who you've become with LS? How do you want to change as far as like emotion, like your attitude or how you go about your day? What are some things that your future self, who you see without the disappointment and the uncertainty and the frustration, how does she manifest? Like, what does she look like?
Well, I really liked what Amanda said about living carefree, because every morning I wake up, I have to do this, and then in the evenings I'm like, oh, should I soak tonight? And then, oh, my friend wants me to go be in a golf tournament with her. Should I do that? wonder how I'll be feeling that day. Oh, it's going to be in August. It might be really hot. I probably shouldn't do that. It might cause a flare if I'm in too hot of humid weather. I'm in Tennessee, which is very hot and humid. I'm sure everybody's having hot weather now, but typically hot and humid here. So, you have that constant thought process of every little decision you make.
Mm-hmm.
It could be a little exhausting.
Okay. So you want to work on kind of letting that constant LS in the back of your mind just kind of
just let it happen, and then we'll deal with it when it happens. Not worry up front about what might happen, I guess.
Right. Yeah. So I think definitely, like you said, with like Amanda, we're gonna work on that plan that at week 5, that the plan for your new normal. That's gonna help you because, like I said with Amanda, we all know at some point we're going to flare. But having the plan to say, okay, I know how to deal with this so I can get back to living and not have to worry about it until the next time I flare is going to really help get rid of some of that constant thinking. So I think for your homework is to, you want to get, for you, I would say we're going to talk about your goals are. Hold on, let me think for a minute. I wrote stuff down. Well, what were your goals because you came in? You said you kind of did the homework a little bit. What did you have?
No, I just know I know about goals and all the stuff that was in there because I used to. This was part of my job when I was working. It was goal setting.
Okay.
This is a little harder for me to work on something that's a little bit more abstract and internally. So I have to really this. I guess one of my goals would be to try to, not worry so much. Reduce my worry, stress.
The worry that you have that's from you fearing where your illness is going to progress, and that your doctors are treating you correctly, right? Those are your main worries. So again, it's kind of like Amanda, the security. You need the security. You're worried. If you had the security, then you wouldn't have the worry, right? If you were secure in your process, if you were secure in your doctors and their treatment of you, you wouldn't have that issue, right?
Right.
So your goal is to get to a secure place where you don't have to worry and think about LS all the time, because you have a plan that you are secure in. Your doctors are working for you in a way that's secure, and you have a plan that if they're not working for you, you know what you need to do to go about making sure that you get the doctors that do work for you.
That would be nice to have a plan that works.
Yeah. Well, the one thing I've learned with LS, because it manifests differently in all of us, it's kind of like you got to try things until you find what works for you. So if the doctor says, okay, try this, and it doesn't work, then they got to try B and then C. But saying that, it's important that they have a communication with you and they say, okay, this is the plan, and you don't feel like this doctor doesn't know what the hell they're doing because they're giving me this medicine and it's not working, and then they're just giving me another medicine. Whereas if they say, okay, this is the plan, we're going to try A, and if A doesn't work, B doesn't work, then C, it looks a lot different than, okay, try this. Oh, that didn't work. Okay, try that. That didn't work. Okay, try. You understand what I'm saying? So they're doing the same thing, giving you different medicines, but the plan of attack is differently. They're giving you security in the fact that they know what they're doing because they're strategically trying different treatments with the full knowledge that this disease treats everybody differently versus, oh, they're just pulling shit out their hat and I don't know what the hell they're about to do because they don't know what they're doing. So now you have security in the first one and none in the other one. Make sense?
Yeah, yeah.
So yes, I think your big goal is security. And like I said, just like with Amanda, week 2 and 3, coming up with those plans are going to be really important for you. And I want you to come up with another 2 or 3 goals that will help you to get more secure with your LS. All right. So, perfect. All right. Do you guys have any questions for me? You have any questions for me?
No.
No? All right.
I don't think so.
Okay. Any thoughts?
No, I'm feeling good about, I mean, although I've said that I'm in an okay place right now, I think that it could only do good to really put some good practices into place to maintain where I'm at right now, because I do feel like the times that I've been okay and then I like relapse into a really gnarly flare up and then just kind of like get down on myself, I think just using these tools and practices will help get back on track sooner instead of just like delving in to the horrible flare up.
Yeah. Yeah.
So it's good tools.
Yeah. Unfortunately, that is part of our new normal, is that we will get flares and we will at some point get down. But having that plan is going to help us to get back sooner. That's the thing is, we can't always be positive all the time. We're human. And life was going to throw shit at us all the time. And we're going to have to deal with it. But it's easier for us to deal with it when we have a plan, rather than just trying to figure it out as we go. You know? So that's the whole process. So I'm glad. All right. Well, you guys have your assignments, and anybody who's watching the recording, go through the process just like we did. Ask yourself why. Why is it that you have these feelings? Why is it that you know, what is it that's going to get you to the place where you want to be? And find those core goals that are going to help you to get to a better place. And then try to find those deep motivations that are going to keep you there. Why do you not want to be back to where you are today? Alrighty. So like I said, I will post the question for your first drafts for your goals tomorrow. And then on Friday we will have, I'll post for the finals. All right. Thank you, guys. It was awesome.
Bye.
Thank you.
You're welcome.
So I have a question. So we're supposed to post our goals to you?
I'm gonna pose a question, and then underneath there you can post what you've come up with, and then, you know, and that's the other thing. Please, if you have thoughts on somebody else's post or whatever their goals, share, you know, because it's not just my voice. I want everybody to have a voice with everybody else, because I'm just one person, and you have different thoughts than me, and everybody has different thoughts. So the more thoughts, the better that person's going to be. So the more interaction we have, the better. Like I said, I'm no expert. I'm just doing what got me through, and just trying to help that way. But like I said, everybody has their own experiences, and the more experiences we know about, the better.
Got it.
All right?
Thanks.
You're welcome. Bye.
All right, bye.